Guys, we are so excited to be here today with Dr. Chopra. Julie and I have a couple of questions that have been coming in, and we are going to get them answered at the source. What would you say are the top 3 requested surgeries you've been getting over the last year?
Number one, thank you for having me. You guys are amazing. I'm lucky to be here. So the biggest 3 that I've seen this year are obviously my defined lift, my deep plane extended facelift, brow lifts, and explants. Those are the 3 big things that I see, and I've been seeing the same things for about 5-6 years.
For your explant patients, what are you doing to create fullness without implants?
Yeah, that's a great question, because many women get implants because they want that fullness. So they get the implants, but a lot of these women react to the implants. So once we take them out, the aesthetics is a big importance. So how can we get that back? The main way we do that is with fat grafting. So we take fat out from the belly, from the legs, wherever they have it, and we inject it into the breast. The great thing about that is that if you have extra fat, we can sculpt your body and you also get bigger breasts. But there are also limitations to breast fat transfer. And that is that you can only go up about a half a cup size every time you do it. So if you really want to be big, fat grafting is probably not the best thing for you. If you just want a little more fullness in the upper pole or round out the bottom of the breast, it's a great option.
With the fat grafting, how does this work with your patients that are on the thinner side and don't have as much fat to give?
Yeah, so that's a really difficult problem to be in, right? Because most women who are thin want the implants again for that volume. And if they don't have a lot of fat, we have to go to multiple places to get that fat. Luckily for me in my practice, I have Dr. Villanueva. And Dr. Villanueva specializes in liposuction, so he's wonderful in getting fat from the different places. So if you have a smaller breast and you're thinner, you don't need as much fat. So we find different places to find the fat, and we try to give them the best result we possibly can.
What are your thoughts on getting CO2 laser during a facelift?
So I love CO2 in general. I think it's a great modality to resurface the skin. So as we age, 3 things happen. We lose the volume, we lose the texture, and we lose our elasticity. We take care of the elasticity with my deep plane facelift, the volume with some fat, and finally the texture. What do you do for the texture? Well, it's a CO2 laser. But you have to be very judicious when you do with a facelift. So when I'm doing a facelift, I may not go very deep out here, but I'll go really deep around the mouth and under the eyes. In general, I tell my patients that when they need resurfacing with a facelift, they're probably gonna have to do another CO2 in about 6 to 8 months to really get the face so we can go deeper. But in terms of texture, it's a wonderful modality.
It's something you can do at the same time as the procedure?
100%. So you can do it, you just gotta be judicious with it and don't go as deep in certain parts where you really operated on.
Do you have any tips for people to make their facelifts last longer?
Yes, so there's a lot of tips out there about tips of how to make this last longer and that last longer. When it comes to my patients, it's all about the basics, right? So there's several things we can do, and what are they? They're boring, but they're tried and true, and those are great sleep, water, exercise, stay away from sugar, away from alcohol, stay away from the sun. If you do those things, your facelift will last forever, and you'll also just look great from the inside out, and that's what we're all shooting for.
When you say forever, how long does the average facelift usually last?
So there's a difference between an average facelift and my deep plane extended facelift. So an average facelift, maybe it's 6-7 years, but a deep plane extended facelift should last about 10 years in someone who has good quality skin.
The eyebrow lift considered a long-lasting procedure? And if so, which do you prefer, the endoscopic one or the temporal one?
So it's interesting. I used to do a lot of endoscopic lifts, and the incision here and an incision here. And now I can do it through just small incision here. So I can do a temporal lift through here, but I release the whole brow still, entire brow, and still get that lift. Even though I am only fixating it laterally, I still can get the medial brow to go up about 1 or 2 millimeters. If I really need the arch to come up, I put a small little incision here and here. So in my hands, when I do my deep plane facelift, my temporal brow is all I really need, because most people as they age, they don't age here generally. It's generally their lateral brow that falls. So all we need is just to really pick up the lateral brow. And it does last. And it lasts as long as essentially gravity will let it last, just like a facelift.
It should last as long as your facelift.
100%.
How do you think the concept of beauty has changed in the last 10 years?
That's a really interesting question, because beauty definitely changes with the eras, right? 10 years ago, even 7 years ago, we were into the big butts. Then we were into the big boobs. And now we're coming back to sort of normalizing everything with normal breasts, normal butts as well. However, now that there's social media, you're seeing these patients from different countries, and I don't want to disparage any countries, but places like Turkey, where you see their eyebrows are way looking like a caricature of themselves as opposed to a natural look. So now we're at a juxtaposition where there's a bunch of surgeons who are sharing ideas between themselves, like myself, Dr. Talley, Dr. Masri, Dr. Azizadeh. We're all exchanging these ideas to make these patients look like themselves, just a better version. And on the other hand, there's people in different countries that are making people look totally abnormal and not like themselves. So now there's a sort of a divergence, and I'm definitely in this camp.
Well, thank you so much.
Thank you for having me. It's been wonderful.
Thank you.